Welcome to the Center Collaborative, Creative Solutions in Behavioral Health and Criminal Justice, brought to you by the Oregon Center on Behavioral Health and Justice Integration, which is also known as the Center. We at the Center are all about solutions. Our job in Oregon is to facilitate improvement of the system so behavioral health and criminal justice can work better together to engage people in treatment while promoting public safety. I am your host, Chris Thomas. I hold a master's degree in clinical psychology and have focused on the intersection between behavioral health and criminal justice for 20 years. Over 7 of those years were behind the walls of a maximum security prison. During this podcast, you will have the opportunity to sit in on real, in-depth conversations with experts about complex topics in a way that is both fascinating and digestible. We will focus not just on what is wrong with the system, but what is going right and how we can work together to evolve. This podcast is a conversation in a series of conversations where we touch on people's legal rights and their options related to seeking medical care. Since our conversations are intended for informational and educational purposes only, they are not a substitute for or a reason to delay seeking professional legal or medical advice. On today's podcast, we are joined by Holly Harris, LPC, Deschutes County Behavioral Health Director, and Sheriff Shane Nelson, Deschutes County Sheriff, to discuss their fantastic partnership and how it has led to the Stabilization Center, which is open 24/7 for walk-ins or for law enforcement drop-off. It is a deflection option from jail or the emergency department with a 4.5-minute waiting time for law enforcement. It serves a wide range of needs and acuity in crisis, with the philosophy of coming from a place of yes. Holly and Sheriff Nelson talk about the importance of their ongoing partnership, both in this project and looking forward together. I learned so much during my conversation with them. I think you will too. Welcome to our conversation. On today's podcast, we have with us Holly Harris, LPC, Deschutes County Behavioral Health Director, and Shane Nelson, Deschutes County Sheriff. Sheriff and Holly, welcome to the podcast. We are thrilled to have you with us today.
Thank you so much for having us.
Thank you.
I've heard a lot about your Stabilization Center in Deschutes County, and I'm excited about the possibility of you talking about that today. So can we start off with you telling our listening audience a little bit about what the Stabilization Center is and who it serves?
Sure. I'm happy to take that one. The Deschutes County Stabilization Center is a 24/7 crisis center that takes anyone of any age, regardless of ability to pay, regardless of residence, regardless of a lot of things, that if you're having a crisis in Deschutes County and you want to walk in and see somebody, see a mental health therapist, you can walk in 24 hours a day and have that need met. We also have a place where law enforcement can voluntarily bring us somebody in lieu of taking them to the emergency department or to jail. And then one of the services we offer out of the Stabilization Center is what's referred to as 23-hour observation. We call it 23-hour respite for individuals who are very dysregulated, maybe psychotic or manic or under the influence or whatever the case may be, haven't eaten or slept in several days, showered, really just in a state that they cannot participate in that sort of typical risk assessment, mental health assessment, and really just need a space to get their basic needs met, get some rest, get some food in their belly, all in an effort to bring their crisis down to a more manageable place so that we can then begin the problem-solving process. So that's our model. We are an entirely voluntary model. And again, we are as low barrier as we can be, short of somebody being brought to us involuntarily, or they're unwilling to be there, or they're actively assaulting and aggressive against somebody. We're really going to take them, try to support them, and get their needs met.
So it sounds like this is for folks who are in that in-between place where they really are wanting and needing help, and yet they don't quite reach that level where you're looking at a hospital level of care, but in that place where typically we don't have a place to take people.
Exactly. We are designed to take that high acuity individual that is not quite at hospital level of care, but we're not really comfortable having them stay in the community either, just on their own, but they're willing to participate with us. But we also do serve much lower acuity people too. So we were designed to serve that higher acuity individual because we wanted to make sure that need was met in our community. But we also serve individuals who are experiencing anxiety, low-level depression, having a really bad day, all the way to somebody who's houseless, psychotic, at risk for incarceration or hospitalization.
See right there, Chris, the way Holly described that, that sounds so great to me because I think some things that we have to remember as human beings and members of the community is that everybody experiences mental health challenges. It depends on what level everybody experiences them, but every single human being will experience a mental health challenge. And when the Stabilization Center was being put into place, I mean, I even said, hey, I would like to go and sit in the lobby or eat some goldfish crackers and have a juice box just so you could have that time to yourself. You need that kind of a mental health break. And sometimes folks just need a little bit of a hand up.
As we've talked about in some of the podcasts, this whole issue of crisis and just having a place to go for a little bit to and get through that initial crisis period with support and getting their needs met can really decrease the probability of that situation escalating for y'all and for them.
Absolutely. We want to be working through these issues as early as possible. One of the things that I think we're doing well, but we've done a disservice to ourselves over the years in the crisis world is trying to box in people's crisis. Oh, that's a substance use crisis, or oh, that's a mental health crisis. Oh, that's a housing crisis, or oh, it's this, that, or the other, so that nobody actually had to deal with it. And I think that's been a very frustrating thing for me over the years. And so we really wanted this place to be like, if you're having a crisis, you're having a crisis and we're going to help you. We're not going to not help you because it's a certain type of crisis. And so that's really how we've come from a place of yes. That's our motto at the Stabilization Center. It doesn't mean that if it's strictly a housing crisis that we're going to provide shelter for the night, but it means that we're going to still help you work through your crisis. And then we're going to get you the resources you need, even if it means we have to drive you there ourselves or whatever the case may be. I think these silos have done nothing but a disservice to our entire continuum of care.
Right, because people don't exist in the silos that we create for them. Sheriff, I'm wondering, for law enforcement in the county, this has got to be a refreshing, an amazing game changer for y'all to have a place where you can take folks instead of the jail or the ER, which are the typical options. But also, you don't have to go through the mental gymnastics of what kind of crisis is this and does it fit? You just have a place where you can take someone and there's no wrong door if they voluntarily want to go there.
I agree completely with you. One of the things about law enforcement is that the ladies and gentlemen that work in law enforcement are fixers. They are problem solvers. And so sometimes when that's the case, we feel like we have to solve every problem or we have to fix every problem, which that doesn't have to be that way. We just have to know where the experts are, where the resources are, so we can get that problem solved or get those folks on a path where they can solve their own problems. When the Stabilization Center started being discussed and now sits across the parking lot from where I'm speaking with you today, when that was starting to be discussed, that was such a breath of fresh air. From my perspective, serving as sheriff, we have a lot of vulnerable individuals that end up in our custody, end up being arrested, and then end up being in our jail. And that's not the best place to provide them services. We do the best that we can. And if folks break the law, yes, we will bring them into our facility. But that's not necessarily the best place for them to receive treatment and get back onto the life of being a productive citizen. The other aspect of that is anytime we have an individual in our custody, it increases our liability. So not only is it the right thing to do to have this option, but it decreases our liability because individuals who are experiencing mental health crisis, they have a tendency to have a use of force that's brought on them or some type of an action like that. And uses of force can be high liability situations. Medical events that are caused by addiction or mental wellness, those can be high liability incidents. So being able to take them to the Stabilization Center and divert them from the criminal justice process when appropriate is an excellent option.
It allows jails to do what jails were designed to do, which was not be mental health stabilization centers.
Yes. And I think a number of law enforcement agencies and a number of correctional facilities have been saying that for years.
Coming from corrections myself and in conversation with a lot of jail commanders and law enforcement, I've heard that echoed many times. So I'm wondering, how long has the Stabilization Center been open in Deschutes County?
Yeah, so we worked on the project for 5 years because these are complicated projects in a lot of ways. After all that time working on it, we opened in June of 2020, so right at the beginning of the pandemic. So we actually have not operated outside of this pandemic that we've been living through for the last 2.5 years. So it's going to be really interesting to compare data pre and post, but we've only known doing this work wearing masks at the very beginning, wearing face shields and gowns and gloves and goggles and all of the things, and then having to try to be one of the few places that were actually providing face-to-face services during a time when most other places had gone strictly to telehealth or not at all.
So this brings me to a question around staff wellness. And I know these are conversations you and I have had and that you hold very dear, as do we at the center. So I'm wondering if you want to talk about that a little bit, because opening a stabilization center, which is a pretty new thing in Oregon, in the middle of a pandemic, which was a situation I'm sure most of us did not see coming. How has that been in thinking about not only how do you address the needs of the clients that come through your door that are utilizing your services, but how are you ensuring staff wellness within the walls of the stabilization center?
Yeah, that's become even more of a critical point because not only did we open a new facility at a time when a new pandemic had hit our world, but also at a time of a historic staffing crisis that hit the nation. So that adds an extra layer of pressure to the people that are there working under those circumstances. So staff wellness has become a really key topic, not just for crisis workers, but across the behavioral health workforce. And we saw at that time when we first opened, the acuity of the people we were serving was through the roof, and primarily because they weren't able to access the levels of care that they really needed to be accessing, or the shelter beds, or anything that they needed to be accessing. So everybody was being funneled our direction, and we were grateful to be open and be able to serve them. But we were seeing things that we had never intended to necessarily be happening at the stabilization center. So there was a really quick learning curve and then a really quick movement to find ways to make sure not only that staff are safe, but clients are safe, but creating safety within our environment. Lots of protocols were developed to ensure staff had what they needed to be safe. Panic buttons and mechanisms and role plays to try to work through those types of scenarios. But then there's the other piece of it, the debriefing, the wellness part of it. And I think we've created a culture at the Stabilization Center that is very conducive to staff feeling safe to speak up, safe to express when they need that time away, to step back, create spaces within the building that they can get a little downtime. And then we have things like the Betterment Committee we've created, staff-led and driven, that allows them to think of how do we make this a better experience for staff? How do we make it a better experience for clients? And that's a key part of what that group is really focused on. And they do all kinds of little fun activities to make the work environment more welcoming and happy place to be. But really, I think the number one thing that helps with our staff wellness is that we are incredibly mission driven. You'll see our mission statement all over the building. We talk about coming from a place of yes all the time. We talk about what our goals are at the Stabilization Center, and any decision we make, because we have lots of like gray areas of staff will come and say, can we do this or that? And we always bring it back to what are we here to do? What is our mission? And when staff feel part of a mission and feel like they're doing good for the community, doing good for our clients, it really helps provide the foundation for doing this really difficult work. And so I think we've created that culture there that I think is really important to helping retain staff.
Being so mission driven, but then also having a space of psychological safety where your staff can come up and talk to you about stuff that they're seeing that is problematic for them, or suss out the issues around our mission and how does this work, and being able to create that culture, I think sounds so important and that you've done successfully in Deschutes County. And then the piece around physical safety, which I know is an ongoing discussion in Oregon, folks not feeling safe working with people who are exhibiting acute behaviors that can be very disconcerting and scary. And how does that happen? So thinking about that as well, I'm wondering, is that a conversation, Holly, that you and the sheriff have had around these ideas? How do we create not only psychological safety, but how do we create physical safety in this environment?
Absolutely. And we've relied on our law enforcement partners because this is their area of expertise, right? So this is where you tap into the expertise that you have around. They use us for the expertise around the clinical side of things, and we use them for the expertise around the safety side of things. So as we were designing the building, I didn't really weigh in a ton on how to keep the environment safe. That was really their department. And how do we do that? And then we have protocols. If we need help at the stabilization center, we know they're going to respond quickly and they're going to respond appropriately and they're going to be there to support us in this work. And that's a sense of safety too. And being so close to them, they're just across our parking lot. It's not going to be 20 minutes before they're responding. It'll be seconds. That really helps. And then anytime we have a safety issue at the stabilization center, they provide a situational awareness training for us. They provide a tactical training for us, especially as we embark on non-law enforcement response through mobile crisis. So anytime we need that safety training and expertise, they're our go-to.
Sheriff, that is such a fantastic role for law enforcement to be playing in this partnership and that collaboration where folks are subject matter experts being able to come together and figure that out together instead of trying to figure out all the stuff that's really not your bailiwick, but still being able to rely on each other as professionals. So I'm wondering, can you talk about helping the stabilization center feel like a place that's more physically safe for staff?
Well, that is an element of a great success, isn't it? Knowing your roles and knowing your boundaries and where to find those resources. But I'll tell you, the success of the Stabilization Center, it's not just from a great partnership, but some of the things the director mentioned is from a place of yes, which is positive attitude, which is solution based. And that's really what you need to have for a successful operation. So when she explains that her teammates believe in it and then she's doing the things to support her teammates, that's what we're all trying to do because they're doing the hard work. And folks can't expect these individuals to be embedded in this type of challenging, difficult work and not have it overlay on their personal lives. So the way that we come in and we're able to help, first of all, they have security there that is on site because after discussions, we felt it was best. We're trying to eliminate law enforcement from the equation because I think that would have the best outcome. And so security is on site and helps their team out quite a bit. But in some of those particular situations where there could be danger involved, I've always said these folks that are trained in behavioral health and mental wellness challenges, they're far more experienced and aware of what they need to be nervous about than I am. So they're going to be able to tell us when they need help. They're going to be able to tell us what they need from us and how we can best support them. And we're able to come in and look at the facility or look at the operation and give a few pointers here or there, some things that we feel might help improve their safety. But at the end of the day, it's up to them. And I'm going to defer to their expertise on what our role should be to help support them in accomplishing the mission. I'm tasked with being the conservator of the peace and keeper of the public safety here in this county, and it's an honor. We're also responsible for the livability of this county because we all want folks to continue to move here, raise their families here, open businesses here, visit here, and all of that stems from great projects that we have that can help that along. So Holly mentioned they only need to call us. We're a parking lot away, and that works with some quick ladies and gentlemen. They can probably make it across that parking lot fairly quickly, but we'll be there when they need us. It's just about knowing our role. And I think this partnership works really well because we're very aware of our roles, but we're also very aware of that partnership and getting those things accomplished.
Well, Chris, to that point, the sheriff's right in that we are really skilled in being able to de-escalate most situations. And so we don't have to call them very often, which is wonderful, especially given the high acuity that we are serving. So only about 3% of the time do we actually have to call law enforcement over there to do what we refer to as a director's custody to actually initiate an involuntary process. So we're talking about a group of people that previously had gone to the hospital involuntarily that are now being diverted here because it's a better option and a voluntary option that they're willing to do. But they're pretty acute and we're able to still work with them and very rarely have to actually call in law enforcement for support. I feel like that speaks to a couple of things, that law enforcement's bringing us appropriate people and also speaks to the staff that work at the Stabilization Center and that they really know what they're doing and they really are skilled at de-escalation and crisis intervention.
So exciting on so many levels in the partnership. This makes me think, Holly, about the training and support for your staff. I have a master's in clinical psychology. Being trained to be a therapist and sitting in an office is really different than crisis work. And so I'm wondering, what kind of training, support, and ongoing supervision are you offering to the folks who work with you in order to have this transformational leadership where you holding your people in high regard and you have great quality product in what you are producing and how those center is being run? How are you supporting your folks through their training and supervision?
Yeah, you are so right in that graduate school does not prepare you to be a crisis worker. It just does not. So I highly encourage anyone who's listening to this that is going to graduate school to do an internship at a crisis center and to get your experience through your schooling in other ways, because the books will not teach you this work. They don't even barely touch on it in graduate school, as far as I know. It's been a while, but when I was in it, they did not. I think really we've had to grow our own in-house training because there's also not a breadth of training out there that we can tap into that's specific to crisis stabilization centers and to doing this work in today's world with the acuity and the co-occurring disorders that we're seeing, the substance use, traumatic brain injury, intellectual and developmental disabilities, all of the things they teach you about separately in graduate school are now all in one presentation, and no one has prepared anybody to work with this population. So it's through experience that we have developed our own trainings in-house. One thing COVID helped with was getting us all in this virtual world. So we have lots of in-house recorded trainings that we can offer to our staff because it's 24/7. So we can't offer trainings Tuesday from 8 to 5 because not everybody's going to be able to do that. So we've had to get really nimble on how we get training out to all of our staff, and then obviously encouraging anytime we see a good training that's in the community to send them to. But crisis work, it oftentimes becomes so local. How crisis work is done in Deschutes County isn't necessarily how it's done in Multnomah County or how it's done in Douglas County. There's some basic core strategies that are evidence-based and things that you can tap into, but so much of it's about the system that you work within. What are your partnerships with your law enforcement? What resources are available? How does your acute care hospital work? All of those pieces of the work that we do, it's very specific. So that's why we chose to just do that in-house. And then our supervision, we've created a model where we have 24/7 supervisor support. So we have a supervisor on site 6 days a week until about 6 or 7. And then we have after hour support where if they need to come in and support staff on site, they will come in. They do week rotation of on call. That's taken years to develop to make sure that we have enough capacity to be able to support somebody at that level 24 hours a day. And I think that goes a long ways for staff. If they're at 2:00 in the morning having to make a really difficult decision, and there's obviously less staff and less resources around, that they can still get a hold of their supervisor and talk that through. And then we have debriefing options, like I mentioned before, around staff wellness. We can huddle and do a SISM debrief if needed for critical incidents. And then obviously we have ongoing regular supervision. I think it's weekly for some staff and every other week for more seasoned staff. We have that structure built in to make sure that they have access to people to talk through these scenarios.
And Chris, a little bit on what the director had to say there. They do a lot of training for our office and law enforcement as well. The crisis intervention training is important. As a sheriff's office, we've been really blessed because we've always had this experience. We treat individuals with respect in our contacts. You become mindful in how you want to communicate because you want to have a good ending. Maybe your backup law enforcement officer is a ways out, so you get good at communicating. But in this particular situation, we have a saying here at our office where we treat people how we want our family members to be treated. And I can't think of any better way to do that than to make sure you have individuals that have empathy for others. And so when we have our mental wellness training here, Holly's folks come over and give us training, and they work very closely with our behavioral health specialists in our facility as well. But they come over and they give us training. And one of the trainings sticks out in my mind because it was a recording of voices that some individuals might hear in their head. And I've never experienced that before. And so when I'm listening to this recording and I'm trying to empathize and I'm trying to picture what that might be like, if I have no control over that situation and it's just ongoing and where I might end up. And to me, it's very similar where every human being has a level of anxiety, whether we realize it or not. To me, it's part of the fight or flight. It's what's kept us alive all these years. And so when you talk about some of these things and you're experiencing some of these things, that gives you a little bit of credibility when you go out in the field and you're actually operating and interacting with some of these situations. And I can remember a time in law enforcement. It goes back to that problem solver or fixer concept in law enforcement where I'd read about deadly uses of force that involved folks with mental health challenges because law enforcement had this concept of, hey, we're here to save your life, only to end up taking that life because of the situation. You talk about a paradigm shift and trying to be better at what you do. And that training just helps that. We've come such a long way as a profession, and we've come such a long way as an office, because now we know we interact in these types of situations and we rely on our partners who are the experts. And we say, okay, hey, we knew where to find the resource, and now we'll let the resource that's good at a great outcome take it from here.
Sheriff, you remind me, we partner with DPSST to form CITCO, the Crisis Intervention Team Center of Excellence. We help support new crisis intervention teams and also help maintain programs through that partnership. And it makes me think of how important the training is, but then this larger conversation about how important the partnerships and the collaboration is. So it's not just a training, it's a program, and how projects like the Stabilization Center can grow out of that partnership of CIT, where you're coming together initially for training and you're working together on that. And then you get to know each other, you get to speak the same language, and then you can start to rely on each other to create larger programs out of that CIT program.
Yes, I agree.
100%. And I tell this to counties all the time that are thinking about opening crisis stabilization centers. The number one thing is, first of all, do you have the partnerships in place? And they can't just be the check the box partnerships of, yeah, I got the letter of support for the grant or whatever, and they're willing to do that. But like true partnerships where they've got your cell phone number, I've got theirs. When we're having a situation that's bubbling up, we can call and have that tough conversation and still hang up friends, and that we're all still good with each other because it's a really meaningful relationship where we don't just talk about fluff. And have even attempted to get a stabilization center going if we didn't have that in place. We looked at a lot of places across the country, and the places that were not successful were the places that hadn't invested in the relationships and the partnerships early on and didn't have a couple of key things in place already to be able to open the doors and have referrals day one, because they trust you to take that referral. It's all about trust, right? And we had that here, and I'm really grateful for it.
I agree 100%. And I think it's important to remember just how Holly explained that there. In order to have that trust, you can't have egomaniacs in the room. You can't have territories in the room. It's got to be service based. It's got to be about providing the service. And that goes back to the responsibility for public safety and doing what's right by individuals. So those partnerships, you really have to break down those barriers or make sure those barriers aren't there. The director hit the nail right on the head. She said, you trust in your partners that they know what they're doing. The fact of the matter is, I think a lot of folks or a lot of organizations may not try something because of liability. And I always tell folks, look, I'm in the liability business. Everything we do has high liability. We're in the emergency business, and so is the director. And so if we're using that as the bar that we have to get over before we do anything, no one's going to do anything. We're all going to be paralyzed. We've got to accept that certain amount of liability and know that we're all going to be risk managers and try and mitigate the number of times that something terrible happens when we're trying to do the right thing. But when you trust your partners, it's a lot easier to do that and go down that path.
You know, we were talking about with the Stabilization Center and really the culture about getting to yes. It sounds like, Sheriff, you are exactly in that same business of getting to yes. And by you both getting to yes, it has created a successful partnership between the two of you.
I agree. As a matter of fact, our kind of informal vision statement around here is we want to put ourselves out of business. I think if you start looking at a way to put yourself out of business, you're going to be proactive. I see that out of the Stabilization Center. I see that out of behavioral health here in the county, and I see that out of the sheriff's office. You be as proactive as you can be, and hopefully that reduces the number of times you have to respond.
The sheriff hit the nail on the head as well around just that liability, the fear, the risk aversion that we see that really kills projects like these across the state and across the country. I've seen it time and again. And there is no risk-free behavioral health. There is no risk-free law enforcement. We're going to have risk no matter what we do, but that shouldn't stop us from doing what's right for the people we're trying to serve. I think we just use a common sense approach and say, okay, yeah, there's going to be some things we got to work out. There's some logistics and regulations and licensing, all that stuff we're going to figure out, but we don't start there. If you start there, you're going to stop there.
Or worrying about this worst case scenario, right? And what happens if this happens? Because you can't anticipate everything. So knowing that if something does come up that you haven't anticipated while you've put in all this process and procedure, but inevitably as with crisis, things happen when you don't plan them and usually at the worst possible time. So knowing that is going to be an issue and that you're going to continue to work on it together and that trust is huge instead of spending all the time and energy trying to think of every possible iteration and how to control it.
We've developed this together, and it's not written in stone that we have to continue to do something the same way forever till the end of time. We are nimble and we're going to adapt and we're going to partner and problem solve around things as they evolve and our system changes. And we just have to know that's the way it's going to work.
I think that is well said, Holly. The fact of the matter is, and I tell people this, people are going to die in our custody. People are going to get sick in our custody. We know that. We're going to mitigate the number of times that happens and try and be better at what we do. Sometimes organizations get lost in what's just happened and spend too much time looking back, and sometimes entire programs get shuttered for it. What we really need to do as a society as a whole, actually, is quit throwing everything out because we have a problem or an issue, and we've got to take a look at what the problem or issue is. Did we do the best that we could? How can we make improvements and keep these programs in place? Because when an incident does happen, it's like you just said, Chris, okay, a terrible incident. Well, like the director just mentioned, we plan, we train, things will still happen. So we just move forward and try and improve the training or the planning. We hope for the best, we plan for the worst, and that helps us through it. But I don't want to see programs get shuttered because something terrible happens. We've just got to learn from it and move forward, because in this particular case with the Stabilization Center, it's the right thing for folks. And these folks need this resource, and we want to keep this resource successful and keep it going. And it has been a huge success. And that's because of Holly and her team's work, and then our great teammates working hard on that project as well.
Also, Sheriff, I'm wondering, I asked Holly about wellness and the impact of wellness that the Stabilization Center has had for the behavioral health side of things. I'm wondering for law enforcement, how having a center where you can take somebody who voluntarily wants to go has impacted wellness for law enforcement to have options instead of the traditional options, as well as the CIT training.
It's been great. I think one of the things, as far as teammate wellness, we've got a comprehensive wellness program here for the office, because you can't expect these normal people doing an abnormal job to go out and interact with some individuals or be put in situations where your average person will never see in their lifetime. And some of these folks are doing it 4 and 5 times a shift. You can't expect them just to be a robot and be fine. Hey, this is your job. This is what you do. Now just wake up tomorrow morning and do the same thing all over again, and don't let it affect you personally. That just doesn't happen. Giving them a different option when they're dealing with folks. For a long time, we'd go out to a scene or a situation, and maybe that individual didn't reach quite the threshold of being a danger to themselves or others, but you don't feel comfortable leaving this individual alone because you wouldn't want somebody to do that to your family member. And so the only options were, like the director explained, you go to jail or you go to the emergency room at the hospital. The emergency room's not designed to help these types of folks. That was a solution that's not the best case scenario. Not only that, they've got resource issues. They're seeing a number of patients. You would find you're spending a lot of time there. So you take a look at financial or resource effects to that aspect. So you're taking a law enforcement officer off the street for hours when now we have this solution that people can voluntarily go to. And I think Holly's going to have to correct me if I'm wrong, but I think the turnaround time is like 3 minutes.
4.5.
Oh, goodness. Okay. 4.5, which, hey, I'm still just fine with 4.5 minutes. I'll tell you that right now. But you have 4.5 minutes turnaround time at the Stabilization Center, and those law enforcement officers are back on the street or out in the field. And then just the whole concept of our law enforcement officers that are working in our jail, those folks aren't having to do these interactions with these individuals that they're not really equipped or specifically trained or an expert in the field to go and handle these interactions. So these folks aren't even going into our facility where our law enforcement has to deal with them in our jail.
I'm glad you brought up the financial piece too, because it's a conversation that I think gets lost. One, I want to talk about financing the stabilization center and how you got there. But the second piece of it that I think sometimes gets lost is, okay, so we spent this much for a stabilization center, but how much did we end up saving in cost avoidance when you start thinking about ERs, jails, and then even just in having people there, but then not thinking about if there are incidents and everything else that can occur in those locations. So I'm wondering if we can move over into this financial conversation around the nuts and bolts of how you ended up financing the stabilization center. And I'm wondering if you do have any statistics around the cost avoidance piece of it.
Yeah, the sheriff's office is our only sustained funding source that has been provided to the stabilization center. And when you talk about reallocating resources from law enforcement, this is a prime example of how that can look. He took money from his own budget and he diverted it to us, and in the amount of, at the time, $570,000, and it's now up to $620,000. And that's money we can count on, that we know is going to be coming. And that is incredible. I'm going to speak on your behalf here for a second, but he did it, and he said it from the beginning that he knows that this is going to save resources from his department. It's also the right thing to do. And he wanted this project to happen. And so he put his money where his mouth was. He wasn't just a supporter in the background saying this is a great idea, but no, this is a project I believe in, and I'm actually going to allocate a substantial amount of resources to it. At the time when we were developing this project, there weren't really a whole lot of other projects out there like this in Oregon that we could defer to and say, look how this one's running, look at the data around this. So we didn't have all that we needed in order to make the case. The sheriff and I knew what it was going to do. We knew the outcomes we were going to get, but trying to convince funders and other people of that at the time was really challenging. What I learned really quickly early on was that if I waited for all the checks to come in to support the project, to get it fully funded before we opened, we may never open. The sheriff's portion certainly helped us get there, but we needed to get other additional funds. So we chose to go the grant route, and we applied for a number of grants and were successful primarily because we had these great partnerships in place and this contribution from our sheriff's office that helped solidify and legitimize this project. It set us up to get the Impacts grant, which obviously was a game changer for us in an amount of about $2.4 million. That got us to 24/7. And the approach we're really taking was we needed to be 24/7 for a period of time so that we could gather the data necessary to demonstrate to all of the people that we need to that this works the way we've said it was going to work. And we've been able to do that. And then we got refunded through the Impacts grant for another 2 years. So we're still in this grant funded phase. We're still working out the long-term sustainable funding, but now we're here, we're 24/7. We have demonstrated good outcomes. No one wants to see us go away. We're working on the funding piece. We were able to secure some funding from the city. We were able to secure some funding from CCO. We're able to piecemeal pieces together, and we're well on our way to being where we need to be. Sheriff, did you have anything you want to add to that?
I want to throw in there because I can give a little bit of insight into the cost savings, because I think I agree with you, Chris, that does play into it and how these things are paid for, because sometimes this information isn't something you can really publish or print. We don't know how many lives the director in the stabilization center has affected or how many future generations. That's just immeasurable. You can't come up with a number there. But what I can tell you is if you have the right mindset and the right attitude and you know that's having an effect, that's good enough for me. And when I look at this, let's just say, I think I did a rough count out of a year and a half of visits into the stabilization center. And I told Holly this, I came up with about 400 folks that were probably diverted from our jail. That's amazing to me, because that's 400 folks who didn't have or invite an opportunity for a use of force or a medical incident or something like that within our facility. But I'll tell you another thing. We average about 1,000 mental health calls, and I think it's actually upwards about 1,500 mental health calls a year. And if I just looked at 1,000 mental health calls a year, let's say half of them end up with some kind of a peace officer hold on them where we would have taken them to the emergency room. Okay. You have 500 and you have a law enforcement officer that's going to be there for 3 hours at a time. And usually it's more than one, depending on the individual and how much help you need keeping that individual under control. So you look at that and all that starts to add up. And let's say half of those calls are peace officer holds, you're looking at a savings of $75,000. Or you translate that to $75,000 worth of more law enforcement activity out in the community, or more visible patrol cars out in the community. And what kind of crime is that deterring? And $75,000 for those folks who don't know, that is a half of a deputy sheriff position at our office. And so you don't have to add a deputy sheriff position if you're doing things and you're adjusting and you're thinking outside the box because you gain more with your existing resources.
Yeah, I couldn't agree with the sheriff more. And this is a big topic for me because I feel like we shoot ourselves in the foot so much by tracking just specific data points, because there's all of those other things that we prevented as a result of the one intervention that didn't happen, that we'll never be able to put a cost to. I had about 4% of people that have come to the stabilization tell us that they would have ended their life had we not been here. How do you put a cost to that? We do know that we've diverted approximately about 30% of the people we serve from the emergency department. And depending on where you get your numbers, depending on who you ask, we've gotten some information that it's anywhere between like $500,000 and $800,000 a year in savings to the healthcare system. Does that come to the behavioral healthcare system? Not necessarily. Does it come to the sheriff's office system? Not necessarily. But we have to stop thinking about, is it going to save me personally money? But is it going to save the system money? And is it the right thing for the individual? And just being more upstream in what we're doing. And so I hope there's somebody out there much smarter than me that will tackle this issue of looking at costs like we have done for other parts of the system, and really thinking about all of those downstream costs that we're saving and putting some numbers to it, because I get asked this question all the time. Well, tell me what you're saving. Tell me about the cost savings. I feel like some real work needs to go into that to truly demonstrate what we are doing, not only public safety as a community, for people's lives long term. These folks coming in crisis, get stabilized, get connected with ongoing treatment, get a job, get their kids back, become productive members of society. What's the cost of that versus not doing? It's such a huge can of worms when you open it up. I get excited about the idea of actually having somebody tackle that. It's just not going to be me.
But what Holly just said there is exactly right. Because how many times do you find in law enforcement or the criminal justice system or families who have mental wellness issues that it just continues? It's generational because they learn what they're raised with. And so when you're talking about a resource like this, to me, the only thing that counts is how many tallies of folks are coming through the door. I don't mind what they're coming through the door for. How many folks are utilizing this facility? And I've told the director that speaks for itself because she shows those numbers. And it doesn't much matter what the outcome was, although it's great to hear the outcomes. One life saved, it's made that whole building worthwhile. But the one thing that we can account for is how is it affecting future generations, and how has it eliminated problems or issues or challenges in future generations, because you have a resource that you're either A, showing your kids that, hey, it's okay to go out and seek these resources, or B, these individuals are getting the help so their actions aren't passing it on for generations to come.
Or even in the immediate now, the folks are getting help. And so they're unlikely to continue to come to the attention of law enforcement over and over and over again, which is better for that person and also much better for resource utilization.
Exactly. So some of the ways we try to tell these stories is through narrative. We gather up success stories that they came to us. For one, this is a person maybe blew through a lot of different systems, had been unable to access those resources, and they are now engaged in treatment, got a job, got their kid back, all those things. And so I had Portland State University come in and do some journey mapping of some clients we served at the Stabilization Center to truly get their story, and then talk about how many times prior to that they had been arrested or been in the ED. I mean, some of these folks, it's a huge number associated with both of those, and that now they're not. And so that's a success. They're no longer going to the ED 30 times in a year or being arrested 22 times last month. That's the kind of folks that we're trying to help and get on the path to success.
And those are wins, Chris. And it doesn't matter the duration of time that
Right.
lasts. I'm not taking anything away from individuals who are trying to get better, but everybody's going to have their hiccups. Everybody's going to fall off the wagon. That's just part of learning and getting to be back on the path of being a productive citizen. But for us here and having a correctional facility, if someone spends 30 days out of jail, that's a win. We may see him again. And Holly and her teammates have had a big effect on that. And even before the Stabilization Center was built, I'm thinking of one individual in my mind who was a big resource user. And I haven't seen that individual since. I know there were some hiccups along the way, and there probably still are hiccups, but that individual really got plugged into some resources and has made their life better.
That is sometimes, I think, the Achilles heel of when we start talking about recidivism rates, right? Because it's just on off, right? Instead of the nuance that we tend to see. Well, was it for something less serious? Was there a longer period of time? Were they coming to the attention of law enforcement or the ED like 6 times a month? And now it's down to every 6 months. That sometimes gets lost in those kind of metrics that have their place, but sometimes I think don't tell the story quite as well when we're talking about the nuances of this population.
100%. Yeah. Success is defined by so many other things. People ask, do people come to you more than once? And I'm like, yes, they do. And we want them to. That means they're continuing to try. That means they feel safe enough to come back to us over and over again. And it means they're not going to the ED. And it means they're not going to jail. They're not coming up for law enforcement. They're coming to us repeatedly. And we'll have them come as long as they need to until we find that window of when we can engage them. Even if they just engage for a minute, they have now have that experience of having some success in their life and what that looks like. And then we can rely back on that. And we can say, remember when that happened? And remember when you were doing well for that period of time? Now they at least have a time to reference. I just look at success very differently than a lot of folks.
You look at it the right way.
This also makes me think of the statewide conversation we're having right now around civil commitment. And having this type of resource available allows for folks, at least in my understanding of it, to get help when they ask for help, which is a problem in other areas where this resource doesn't exist. I've heard that from other providers. We had Kevin Fitz on our podcast a couple seasons ago and talked about the frustration of someone coming in and asking for help and not reaching a level where they can get help, right? So you had to go away and then it had to get to a level of crisis or decompensation. How can you continue to stay motivated to get help when you're being turned away when you're asking for it? But then also this piece of every time someone decompensates, it gets harder and harder in their long-term stability and wellness in their life, and how this can support folks to have continued wellness versus cycles of decompensation, then someone getting to a point where we are looking at civil commitment. I just think it's so important to have options in between versus the alpha and omega of options when we respond.
We really worked hard to kind of shift. We had the culture here too, where to shift from trying to define people's crisis to mobile crisis to be called upon. It has to reach this threshold. You got to be suicidal, homicidal. You got to be psychotic. Like, no. If you're having a bad day and you think you're in crisis, then you come and you get help from us. And we're not going to tell you that your crisis is too big or too small for us to manage. We will help you work through it because it's exactly what you said. The earlier we can get people support and help, the more success they're going to have long term. And in terms of their brain functioning, if it's like a psychotic disorder, we have lots of research around that. If you can catch it early, first break psychosis, people get help right then, start to get the treatment they need then, you're going to see much better long-term outcomes for individuals in that situation versus somebody who continues to have psychotic episode after psychotic episode and no treatment. It's really important for people to get the treatment early and when they want it.
I want to add to that, Chris, the whole situation that we find ourselves in, and I'll just say we as a society, we put ourselves here. We are here because starting down this road 50 years ago, they thought medication would work so well. And I'm not against shutting down the 100-year-old mental health hospitals, but that goes back to just abandoning a project instead of trying to make improvements. Because to me, the question is how we as a society are responding to these issues. Is it humane? And I don't think it is, because what we found is now these types of resources or the responsibility for caring or coming up for solutions is localized with no checks issued, with the exception of grants or different things like the state's trying to do, or in some cases, the federal government. But when did that become okay? Because I think what you find is a lot of agencies or a lot of people are doing the best they can. But when the director speaks about some of those things, I mean, it is terrific what the Stabilization Center is doing and taking on. And Holly and I just had a conversation the other day about some ideas she has and how she wants to further some things. And I'm excited about it because it's going to be nothing but a help. But what it's going to take is us taking a look at what is humane for people as they go about their life and what kind of an impact can we have on helping that along.
The lack of robust funding in the community after deinstitutionalization is something we're all well aware of and something we're continuing to deal with. I'm curious, Holly, there's a lot of assumptions around how behavioral health programs and interventions are funded. And there's a lot of assumptions that Medicaid will fund everything. And what the thought is versus what I've seen happen in practice when we were talking about populations that just go to their appointment, sit through all the paperwork, take their medication, like traditional healthcare, The Medicaid funding doesn't quite fit working with specialized populations. And I'm wondering about that with the Stabilization Center and using those federal dollars and Medicaid funds. How does that work? Does that work at all with the population that you're serving? Like, how is that working out?
Yeah, I get asked this question a lot from other states and people who are trying to get a stabilization center going. They want to leverage Medicaid funding to support it, to fund it. And I'm like, don't do that. Don't do that because it will nowhere near cover your costs. There is no Medicaid billing code to support somebody who's not interested in treatment, who might be willing to talk to you on occasion and start engagement work, or who wants to go sit in a recliner for 6 hours while they sort of settle down. There's no code for that. And private insurance, my gosh, covers almost nothing of what we do. So Medicaid will cover some of our basic for the person who can come in for the assessment, and that we can get enough information from that individual to develop an assessment and then create a service plan and then create some billing codes to capture maybe some of our peer support and case management. But again, once they go into the recliner and all of the pre-treatment work that goes into convincing people and working with people and building rapport to convince them to even come inside the stabilization center and continue those services, none of that's capturable. These traditional mechanisms that come with Medicaid funding of having to do all these different steps and expect that a person who's experiencing full-blown psychosis, is houseless, and hasn't eaten or slept in several days, maybe has a co-occurring traumatic brain injury, is going to be able to go through all of these various steps, complete these processes, and have that be a meaningful experience for them. That's unrealistic. It's not the population we're working with. We need pre-treatment funding. We need it not to be tied to all of these regulations that come with Medicaid dollars. It needs to be flexible. It needs to not be siloed. I mean, we're grateful for the historic legislative investment we got last year for behavioral health. It's getting us closer to being at baseline of where we need to be, but in order to do all of this extra work, there needs to be a massive amount of more investment in order to do that effectively.
It makes me think too, Sheriff, you were talking about the hearing voices training earlier with CIT. And I remember, at least in a lot of them that I've gone through, where you have headphones on and there's voices talking to you. And then there's usually people talking around you as well. Like if you were in a clinic and trying to fill out paperwork. And the amount of paperwork that is required to get services does not, at least for me and my understanding, doesn't seem to match well with what someone is accomplishing in that moment in order to obtain services. And this is where the funding mechanisms and rules don't match well with the reality of the population.
Right. Very right. I call that bureaucracy. I don't know what other people call it.
That's a good word for it.
I call it bureaucracy because it is exactly what the director just explained. All of these things, it's got to be siloed. It's got to fit in a box in order to provide this service. That's the backward way of looking at things. Like looking at the price tag. Yes, the price tag of providing a service should be in the back of your mind, but only from the standpoint of, will that service you're trying to provide help you accomplish your mission? If it will help you accomplish your mission, and as always, it's the right thing to do, then it should really be less of a hurdle. I mean, it should be a no-brainer, really. She approaches it from the right angle where you come from a place of yes. Guarantee you, if you come from a place of yes and a positive attitude, you're going to find all the great things that can help you get things done. If you come from a bureaucratic attitude where, no, this is what we got to do, we got to have this paperwork filled out, you're talking about individuals who all they want to get a service. Well, Holly and her team has made this very easy now to get that service, or at least find a location where you can get a warm handoff to more in-depth services. You bet. Folks have enough hurdles to trying to get help. We don't need to throw more hurdles at them through a bunch of bureaucracy.
Yeah, and I just have to do a little plug for the reduction in administrative burden that particularly community mental health programs are advocating for strongly, because every bucket of money that comes our way, there is a enormous amount of reporting requirements and paperwork requirements that we do certain things and track them and report out on them. And it's gotten to the point that we have so many buckets of money that are tied to specific types of services that then we have to spend half our time just trying to generate the reports to keep the money. And we really need to be focusing on how do we make that funding less administrative burden so we don't drive out our clinicians from doing this great work because they're too bogged down with all of the requirements and paperwork when really we just want to be helping people. I mean, if we could get back to helping people, and I do worry as stabilization centers are becoming a hotter topic and something that may or may not be required of certain counties or developed in certain areas, that we are looking at models that have done this without a lot of layers of bureaucracy, where we developed our own model and it's working really well. So I hope that as these things become funded at a statewide level, which would be amazing, that they don't also come with enormous amounts of layers of bureaucracy that it will prevent certain places from being able to actually pull it off, particularly our rural areas where they have less staff and less administrative support.
I think, Holly, and I'm not meaning to put words in your mouth, but I'm also thinking about what people might say. I think what I'm hearing you say is, yes, there needs to be some administrative piece of it, and there needs to be some checks and balances. But the amount of administrative burden with all the types of funding to try to get the job done becomes more about the paperwork and the admin than it is about getting the job done. So the question isn't, I want this money without any strings attached. I don't think I hear you saying that, but that there's some thought about how all this funding and reporting braids together and the amount of time that it ends up taking and how that takes it away from the work.
Yeah, let's talk about outcome. Let's talk about what is the money doing for people's lives. That's a metric I can get on board with. And I gather all that up and report out on that every single month to anyone who'll listen to me. But what people don't care about is whether or not we got that little box checked that did this one little thing, or whether we had our particular policy signed by a particular person at a particular time. All of those little details that get bogged down in all of these requirements that come with funding. It's not meaningful in a lot of ways. I mean, there absolutely should be accountability, but let's talk about what accountability really means and what we're trying to accomplish with funding.
Exactly right there. That's part of that trusting partnership piece. That's part of trusting the experts who are doing what they're trained and experienced to do. So Holly can provide the information that would absolutely confirm the reason for that money and why it's being used. And I completely agree with you, Chris. You trust, but you verify. Verification process can be far simpler than it is, which is why you don't see folks putting in for grants as much as they used to, at least as much as our office used to. There's too much red tape. There's too many strings attached. It starts to burden our existing resources, which defeats the purpose of getting the grant.
Yeah, with almost every grant we have applied for in the past 5 years, we've had to build in an administrative person into that funding to do all of the reporting. That's inherently wrong with that, in my opinion.
A field trip's the best way to verify.
Yeah.
Holly always gives me numbers and shows me and explains things that I would have no idea about. She's a great partner. Well, the same can be done for the folks that are funding through grant processes.
Well, let's talk about some success stories. Now, I know we need to leave out details because we wouldn't want to inadvertently reveal anybody's identity or situation. But on the other hand, I also think it might be helpful to talk about what kind of successes have happened through the Stabilization Center that really it's difficult to get to on the money, paperwork, metric side. How has the Stabilization Center really impacted lives and the way that folks are functioning within the community in Deschutes County?
Gosh, there's so many. And I think I talk about it in broad terms now because there's so many cases like this. But I think the one the sheriff was referring to earlier, this individual he refers to is somebody that when we were building the Stabilization Center, we were like, this is what this person would need. If we had this, we might not be seeing the 240 arrests that this individual had last year. I mean, we're talking numbers like that. I think the individual had spent 200 plus days in jail multiple times each year for years and years and years for low level stuff that was not high level crimes by any means, but primarily because of this individual's psychotic disorder. Now that person is no longer coming up for law enforcement, got access to treatment, and has built rapport with family. And those are the kinds of things that law enforcement notices because they spend an enormous amount of time with this individual for many, many years, and they are no longer doing that. Now they might be spending time with a new person, and we're going to work on that person now, and we're going to work to have the same success. But I mean, I've definitely had individuals that have come through, and I've shared this through our impacts grant, that were unemployed, houseless, psychotic, lost their child, and came into the Stabilization Center repeatedly for periods of months on end until we were finally able to build the rapport necessary through our peer support specialists in particular, demonstrate why medications might be helpful, getting them on a long-acting injectable, and then they're able to stabilize outside of a hospital setting and ultimately get employment and ultimately become sober and ultimately get their kid back. That is a story that's happened. And they wrote letters to thank us for the work that we did on their behalf. To see something like that come full circle, and yeah, we don't see stories like that every single day, but the fact that we saw it that time was incredible for staff to see. It was worth all the hard work. And whether that individual stays in that state forever, that's not the story that we're here to tell. But they had it in that moment, and they know what that looks like to get their kid back and have employment, be sober. So that was a huge success story. We have other situations where I think the beauty of the stabilization comes in too. It's like, you don't have to fit that criteria in order to get our services. We had an individual experiencing dementia that was not from our community, that ended up here. Law enforcement, of course, got called. No one knew where their family was. They had no place to take this individual. It was like, what do? We don't even know where they're from. We need time to figure it out. So the individual stayed with us, and we supported them while we found their family and got the person back to their community. There's not a thing that we're going to be like, oh, sorry, that's not what we do. Good luck, and hope you're able to figure all that out. And I'll let this poor person stay with you all in dementia state. Like, no, let's put them in our recliner. Let's have them stay with us for a little bit while we figure out how to best support the individual.
There are so many success stories like that. And I'm thinking of another individual that never had good rapport or communication with law enforcement, gets tapped into the stabilization center, and we don't see that individual for 90 days and is actually taking advantage of the programs and the work that the stabilization center is doing. Now, I've lost track, but I will tell you from my perspective, it's just like the director mentioned earlier, 90 days is a win, because that's 90 days that individual didn't darken the doorway of the jail. And we've been over some of the things that can happen and the what ifs that are high liability and high cost. But that was the absolute right thing to do, to have that individual connected with those services, and they did it so well.
When I hear these stories and the passion and compassion that you both display in talking about them, it makes me think of not only being connected to the what, but connected to the why of our work, and how these stories really demonstrate that. So the what is a stabilization center, the what is it's a place for diversion, but the why is not only the money, but also the changing in people's lives so they can lead more fulfilling, full lives instead of being caught in a cycle.
Absolutely. Over 100 people have told us that they would not be here today if they hadn't been able to walk through the doors when they needed to walk through the door, get the help that they needed. Like the sheriff said, if that had just been one person that told us that, that would have been reason enough to do this work. And that's just the people who knew for sure what they would have done. We had probably another 30 to 40% of people tell us they have no idea what they would have done. They don't know where they would have gone or what they would have done to themselves or to somebody else if they had not been able to access the help when they needed it. So 24/7 stabilization centers, not everybody can pull those off. But I think even though I knew our volume overnight was not going to be like our highest volume time, what I tell people all the time is our highest value time, because at 2 a.m., there is nothing else for you other than an emergency room where if you're not meeting a certain threshold, they're not set up for that, or law enforcement. And those are not good options for most people, and be able to have that around the clock. And you don't have to have your crisis between 8 and 5 anymore. It's really meaningful.
That really affects me. And that really affects all the folks that we work with, because it truly is a fine line between life and death in a lot of these individuals that we encounter or we come into contact with. And so when she says 100 folks that we know of that have had their life saved, when you really let that sink in, and how many times have you read a story about individuals who had jumped off a bridge and survived? And the moment, what do they say? I decided I wanted to live. And so to be interacting earlier and come in before and be a resource for that is the absolute right thing to do. Why do we do this? We do this because we live here. We do this because this is the type of treatment that we would want for our family members. And we do it because it's the right thing to do.
It makes me think with those folks too, if they didn't quite reach that hospital level at 2 a.m, but they had nowhere to go, what possibly could have happened?
Oh, yeah.
Versus having some place to go. And it may be because it's been through COVID, so we know that that has messed up all of our data. I'm putting that caveat in there, but I'm curious if having the stabilization center has ended up impacting your competency and civil commitment numbers in Deschutes County.
You know, it's hard to say because it's just so hard to civilly commit anybody in Oregon. And even when you are able to civilly commit them, it's even harder to find them the appropriate placement to get treatment in their civil commitment. So all of that plays into all the efforts we try to do to avoid civil commitment, because it's just not you going to provide the outcome that any of us want. It's much better if we can serve them So I can't really speak to it because of the rising population as well as the rising acuity. We're seeing the lab placements. All of that just sort of feeds into this whole system. So I can't say the Stabilization Center has saved us from having to civilly commit individuals more or less. Our focus on the crisis program is always the least restrictive whenever we can possibly do it, which is why we were pretty adamant around having a voluntary model, in that if you provide a safe place where people know that they can come or go, they're generally going to come, and they're going to feel like they can leave, but they generally don't want to. And so providing that sort of least restrictive, trauma-informed environment where they can get the help they need is going to work for most people. There is that segment that we absolutely need the civil commitment process for, and we need our civil commitment process to work for them, and it doesn't currently.
And one of the things, Chris, that I think about with the Stabilization Center is also think about it drummed up business. It reached folks that wouldn't have necessarily walked in and visited with mobile crisis or behavioral health. It's like if this town doesn't have a hot dog stand and all of a sudden we put in a hot dog stand and people didn't even know they liked the hot dogs, right? So it's one of these things where it kind of created its own client base to a certain extent. And Holly can correct me a little bit there, but it's treating people that maybe wouldn't have used services that already existed.
Oh, absolutely. And COVID really did impact that group of people because those people stayed home because we were told to stay home and not to do face-to-face interactions. So that group of people really did stay home in the beginning. We are finally seeing what we refer to as just lower acuity, moderate acuity individuals seeking help earlier on. We're finally starting to see those numbers uptick, which is great, which is what we want. And people are feeling safe to get back out there. I mean, there was a lot of talk early on about whether or not anybody would come because we were on a sheriff's campus. And that has not been the case for us. And they were also worried that the people that were higher acuity that had law enforcement interactions also wouldn't come because we were next to the sheriff's campus. That also didn't play out to be true. So I think we've created a place where we can still be near our sheriff's office partners. We can be part of the overall public safety campus, and you can create an environment that people still feel like is welcoming and separate enough from law enforcement that they feel like they can come to.
Look, the need for behavioral health and mental wellness programs and facilities is only going to skyrocket. And then you throw in there, we're going to have a major lockdown on a pandemic, and people's social skills suffer. Their companionship suffers. And then you throw in just the addiction issues from folks that are self-medicating. So there's more need and more demand.
So in the time that we have left, because I'm keeping an eye on our clock, anything that we haven't talked about that you definitely want to make sure that we touch on?
I know there's a lot of momentum. I've talked to 12 different states and probably 9 different Oregon counties around stabilization centers and what they can look like and the models that are out there and our model in particular. So there's a lot of energy around creating these, and I support them 110%. I think every region of a community needs to have this type of access like this. It doesn't have to look exactly like the way we're doing it, but 24/7 access to crisis services in person with a multidisciplinary approach. And the partnership with law enforcement is critical. As much as we're trying to get law enforcement out of this work, they're always going to somewhat be in it. Like there's just no way. They're law enforcement. They're going to encounter everyone in the community regardless of what's going on. So we need to build the infrastructure to support those partnerships. And then communities really need to invest in those partnerships because they are critical to being able to successfully serve this population and support one another as we're all trying to navigate really challenging times.
Chris, kind of similar to what Holly mentioned earlier, where it's solution-based and it's positive, basically come from a place of yes. You've got to tear down those territorial barriers or what the responsibilities are, whose job it is. Who cares? Yeah. Let's all band together and just try and get it solved because you focus on the solution. You focus on the mission or the service that you're providing. And I'll tell you, Holly didn't even mention, but she's already thinking outside the box. So Holly is moving forward because she said a key thing there, taking the law enforcement out of the equation because we don't belong in every equation. And one of the things that Holly's starting and moving forward with is going out into the field and taking those non-emergency dispatch calls as a first responder. So her and her teammates are going to do that. And they're going to go out in a vehicle and they know when it's safe to do so. And if it turns into a situation where they need assistance, they're going to call. But that is cutting edge. The mobile crisis assessment team has been around for a long time and doing similar things that everybody always refers to the cahoots model. And I have a lot of respect for that. But one thing to remember is that Holly Harris and the behavioral health team here for 20 years have been doing very similar things and operating out in the field and creating that solutions-based program. And I can't say enough about it. And that partnership it's the right thing to do and getting those things accomplished. The other thing that I will just mention just real quickly as an aside, the Stabilization Center that Holly was the program manager to, they really have a general rule where we're not going to take folks who are on substances. Holly does all the time, because the fact of the matter is the substance abuse, the addiction issues, and the intoxication issues are all hand in hand with the mental wellness issues. You don't know where one starts, one ends. And so her work and the invitation to bring everybody in, unless it's an extremely dangerous situation, has been extremely helpful. And in today's world where we have fentanyl on the rise, it's cheap to make, it is highly dangerous. And you have folks that are going from experimentation to death. There's individuals that are not going down this path to addiction because they're passing away after the first time. 4 years ago, Idaho high-intensity drug trafficking area said that 700 doses of fentanyl were seized. Today, 1.5 million doses of fentanyl were seized by the Oregon-Idaho High-Intensity Drug Trafficking Association. So you take a look at those numbers, and there's just so many challenges getting piled on the already existing challenge that we have. And so it's just to have the director and her teammates and having that positive force and that solution-based approach as our partners. Just by nature, we're intertwined. So why wouldn't we be intertwined in a good partnership and response to ensure public safety and doing the right thing?
The sheriff said it well. That trust and that partnership has allowed us to explore things like non-law enforcement response, because I tell you, we wouldn't even dare attempt to do it if we didn't know we had the backing of our partners and the expertise of our partners to help get us prepared for that. The financial partnership, the sheriff fails to mention, he also bought us a van to be able to do that work. His staff have provided an enormous amount of training to get that team up and running. We've got radios that the sheriff's office has helped provide so that we can be tapped into the CAD system and take calls directly from 911. And again, our partnership also with 911 and all the relationships within the county to be able to pull something like that off and to use a common sense approach is really what we try to do. The Stabilization Center, if we set hard boundaries around who we were going to serve and who we're not going to serve, it really limits the success that you're able to have, and it limits the trust your partners will have in you around knowing if they're going to get it right or not by bringing a particular person to you. And then they're just not going to bring people to you, and people are just not going to get the help that they need. So I just value our partnership, and I just think we demonstrate that with partnership, you can do pretty great things.
I agree, and they don't turn many people away. And the folks that do get turned away belong somewhere else for the help they need.
Well, I think that is a beautiful place for us to end. I am so excited to hear about the Stabilization Center and the partnership that is happening in Deschutes County. I thank you both so much for your time today to give us the opportunity to learn more about the work that you're doing and your partnership. So thank you so much for coming on the podcast. It's so appreciated.
You are welcome. Good to see you, Holly.
Good to see you too.
Good to see you, Chris.
You too. You too. The Center Collaborative is a production of the Oregon Center on Behavioral Health and Justice Integration, a specialized division of Greater Oregon Behavioral Health Incorporated. It is produced by me, Chris Thomas, with production assistance from Patrick Kennedy. Music by Pat Mulvihill and Patrick Kennedy. Subscribe to the Center Perspective using your favorite app. To learn more about criminal justice and behavioral health integration in Oregon, visit the Center's website at ocbhji.org. You can also find us on Facebook. We'd love to hear from you. Please reach out to us. Join us next time as we chat with the experts about programs and partnerships that work within this complex and yet compelling field. Thank you for joining our conversation.